Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Medicine is one of the best compensated professions in the United States, but perhaps one of the most misunderstood when it comes to how people get paid. Joining me today is Katie Gilfillan, a policy director at the Healthcare Financial Management Association. Katie, first, let's talk about where the money goes in healthcare. Let's say I'm not feeling well, I go to the doctor. Who gets paid for that visit?
So decades ago, most doctors owned their own practices, and they would use the money that they were reimbursed for the care they provided to collect a salary, and then for the operations of their business, such as renting space, paying nurses, paying their medical staff and their billing staff, ordering supplies for the practice. Today, more physicians are employed by large group practices, hospitals, or health systems. And this shift changes how they're paid. Some physicians are paid a straight salary, like many who work for large health systems. Others are paid on productivity, meaning the more visits they do, the more tests they do, the more procedures they perform, the more they earn. Increasingly, doctors are being paid on value, things like patient satisfaction, safety, how well they manage chronic conditions. And in many cases, physicians are paid on a hybrid model, which would blend salary plus productivity plus some sort of a quality bonus.
So let's talk a little more about value for a minute and value-based payment and what that means. What does that mean from a patient perspective? Why should patients be thinking about this?
So traditionally, doctors are paid under what we call fee-for-service model. The more visits, the more tests, the more procedures, the more they earn. And that's still very much the basis for healthcare in the United States. The problem is that rewards volume, not necessarily better outcomes. So there's this movement towards a value-based payment system, and value-based payment is different. It rewards hospitals and doctors for keeping patients healthier, improving outcomes, and reducing unnecessary costs. For example, a doctor might receive a bonus if their patients with diabetes have better blood sugar control, or if patients avoid preventable hospital stays. So the care will focus on staying and keeping you healthy rather than just seeing you when you are sick.
That's it for us today. I'm Erica Grotto for Hi-Fi Health News. Thanks for watching.